of August 13th, 2020. I would like to do a roll call, please, for the school committee members being present. Tim Lepre?
Present.
Janilla?
Aye.
Zona Butler?
Aye.
And Steve Sudovic?
Present.
Thank you. And Pauline Proch, Chair, present. I would like to call the meeting to order and ask for the approval of the agenda. May I have a motion, please?
So moved.
Second.
Second.
Thank you. And may I have approval, Jen Illa?
Aye.
Thank you, Tim Lepre.
Aye.
Zona Butler.
Aye.
Steve Sudovic.
Aye.
Thank you, and Pauline Proch, aye. Before we start this meeting, I am going to read into the minutes for August 13th that I am Pauline Proch. I am chair of the Nantucket School Committee. Please permit me to confirm that, well, I've actually already confirmed that the members are present here. I would also like to call names of those who will be speaking this evening and also working on the chat for us. When I call your name, please, please respond. Superintendent Dr. Beth Hallett.
Present.
School Committee Clerk Logan O'Connor.
Present.
Director of Technology Jennifer Erickson.
Present.
Thank you. And we have a guest this evening who is Roberto Santamaria. He is the Director of the Town of Nantucket's Health and Human Service Department.
Present.
Thank you and welcome. We also have our entire leadership team present this evening. And I know we have many people watching us from the public, so thank you and welcome. This open meeting of Nantucket School Committee is being conducted remotely, and it is consistent with Governor Baker's executive order that came out on March 12th, 2020. And it was due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings and such. The governor's order suspends the requirement of the open meeting law to have all meetings in a public, accessible physical location. Further, all members of the public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment. For this meeting, Nantucket School Committee is convening by video conference via Zoom app as posted on the town's website, identifying how the public may join. Thank you. Well, welcome everybody. I expect to have full conversations this evening, and I want to thank everybody who has reached out to the school committee and to our administration, voicing your comments, concerns, and ideas. I'd like to invite Dr. Beth Hallett to begin this evening by giving us a brief overview. She is not presenting the plan. We have all seen the plan. We've had it, we've read it, but I would like to invite Dr. Hallett to give us a brief overview, please.
You can open with a roll call vote, please.
Thank you. May I have a roll call vote for the opening of the meeting? Tim Lepre?
Aye.
Janilla?
Aye.
Zona Butler?
Aye.
Steve Sudovic?
Aye, but what are we saying aye to again?
The roll call vote to open the meeting, Steve. And I got your aye. Thank you.
Okay.
Hallett.
Aye.
Dr. Hallett, would you like to, we did have a motion, Logan, and we did do that. Thank you. Dr. Hallett, would you like to begin with your brief presentation. Thank you. You are muted.
Thank you. Good evening, everyone. Tonight, we are asking you, the Nantucket School Committee, to vote on the draft comprehensive plan that we have shared with you for returning to school in the fall. This has been presented and shared not only with you, but with the Nantucket Public School staff, parents, the community at large. I wanted to share that this has been one of the most challenging times that any of us has ever been faced with. We are trying to plan for situations and scenarios that no one has ever dealt with before. We have asked for your patience and really from everyone, and we will continue to ask for your patience as we continue to collect important data, that we work as fast as we can to set protocols based on the guidance that is still being released daily from the Department of Education, from our local and state leaders and the CDC and other entities that provide new information all around the pandemic and COVID-19. I wanted to acknowledge the countless hours of work that have been put into this plan through research, brainstorming, conversation, and really to come up with what we believe to be the best possible plan for the children of the Nantucket Public Schools. We are proposing a hybrid model in which some students will begin in the building face-to-face for some face-to-face instruction, and others will be learning remotely with a phased entry in our first 3 days. As has been stated numerous times, the health and safety of our students and the staff that work with them is the top priority. It is clear that there are some students and staff that will not be able to come back in person due to serious documented health concerns, and the district will continue to work with people in that high-risk category. The plan presented is firmly grounded in the health metrics that Governor Baker has recently released, putting Nantucket in one of the lowest possible risk categories with less than 1% rate of infection of COVID-19. We have consulted numerous times with the experts in our health community, including Mr. Roberto Santamaria, who is present this evening and happy to answer questions from the committee members. The plan is also grounded in research and understanding that children and those that educate them must have the opportunity to build relationships, establish routines and classroom norms, and address the social and emotional needs in person as soon as possible. We know that our students have lost ground, and in some cases they have regressed. We know that for many of our students, remote learning was not successful and they struggled. We also know that some students count on the safe and nurturing environment of school to give them stability and safe conditions for learning. But we also know that the success that we did have in the remote learning period was also due in part to the relationships that were built and nurtured with students up until March. We have to allow those relationships to be built early on in the school year for us to be successful in any model that we have, whether it's hybrid or remote learning. Please know that none of what you have read in our draft plan has not taken into consideration the factors that I've just outlined, and that we stand firm that this plan that we present to you is the best possible way for us to bring students and staff back safely to school in the fall. So now I will turn it over for discussion.
Thank you, Dr. Hallett. At this point, I would like to open it up for public comment. I wanted Dr. Hallett to open up the meeting first for our viewers. And I know that there is a bit of delay. Jen Erin is monitoring the public comment, and I know that there is one already. Jen, would you like to read that out with the name, please?
Certainly. Rob Giacetti states, "This is not a test. Our kids need to get back to school."
Thank you, Jen. I'm going to give a few more minutes to let other comments come in, as we do know there is a slight delay. The evening will go where we will hear from the school committee members. They will ask questions and have time for their comments. And it will be a back and forth with Dr. Hallett and perhaps some of our leadership team and Roberto Santamaria. and then I will also open up another opportunity for public comment. It is comment purely unless we deem that it's appropriate to answer, but it's really more looking for comments during public comment. Please, Jen, would you like to give us the next comment?
Yes, Tracy Maylou states, I am wondering if there is an update on school committee meetings returning to face-to-face in the LGI or other locations. Other committees in the Commonwealth are. And there are further comments.
Great, terrific. Yes, that will be a future agenda item. Thank you. You can continue on with the comments.
Now, Madam Chair, may I just ask, hasn't the town also mandated that we meet only by video?
At the moment, as I understand it, it is Governor Baker's request and it is a local request. We should and will have this as an agenda item at some point, but we do need to do some background information before we can speak in an educated manner about it. But thank you for asking that question. And I know you have a question, Mr. Sudovic, but I will get to you after we've finished public comment, okay? Jen, please continue.
I apologize. Some of the names are not actually names, so I won't be identifying them. Traditionally, before the first bell rings, all grade level students gather in the cluster to play with shared items or join walk and talk in the gym. What is going to be the alternative, since that clearly isn't safely possible given social distancing guidelines?
Thank you. Other comments?
Rob Giachetti says that was not my real comment. I believe we should go back to school full-time in person. The school committee has a letter I wrote explaining why. Another comment without a name I can read is, walk us through what recess would look like for kindergarten students, assuming we all won't be going out together as a full grade level. Will the playground equipment need to be sanitized between groups? Is there a plan for pickup and drop off in staggered surges so hallways are not crowded? That was the same person, and there are more.
Please continue.
Claire Latter asks, I'm wondering who will be monitoring my children's work on the computer during the hybrid model. That is if their teacher will be teaching in class. Another comment, no name. How can we manage to practice fire drills and active shooter drills? Which danger should be prioritized more? Many of my students have movement breaks built into their school day as an accommodation due to their diagnosed disability. When, where, and how can these take place safely? Anthony Supa, I am in favor of the NTA's letter to the school committee. I think it is going to be extremely challenging if we were to go back to school in person in any capacity and then have to transition to remote learning. Erica Mooney, the town is not encouraging in-person meetings at this time. We are not encouraging any committed to meet in person yet. Michelle Starr states, I read the article in the paper today and I was wondering if all teachers agreed to the content. I have spoken with many teachers over the sum and overwhelming response was to go back to school. Another comment, no name. What is the protocol of a student if a student is exhibiting symptoms but a parent refuses / is unable to get them from school or keep them at home and or get the child and themselves tested? Alexis H-W states, teachers and most school staff are not healthcare providers and therefore have not been provided with training or proper infection control measures and the proper use of PPE. Alexis also states PPE should be provided to the staff Therefore, trainings should take place prior to when the staff and students physically enter the buildings. Jessica Douglas states, I have a child with autism that is regressing. OT, speech, ABA therapies are not the same over Zoom or Google Meet. With the less than 1% plus COVID rate, it is safe for the hybrid model. AC Gear, Governor Baker allows gatherings of up to 50 people in person per his statements yesterday. Kate Garrett, the infection rate is less than 1%, 0.97 to be exact. It's ideal to be less than 10%. Clearly, the statistics are on our side. All of the metrics and trends are positive. No name, oops, hold on, I have to find the place. What is the protocol for when a student refuses to put back on in the classroom? Do I have to do a room clear? No name, if a student is sent home but on an IEP with behavioral goal, is that even legal to send them home for noncompliance? Deborah Davis, Michelle Starr, 70% of teachers are in favor of remote start and then gradual hybrid. Kate Garrett, we can currently keep up with all demands and contact tracing. 40% of the COVID positive patients have been between the ages of 20 and 29. It's not spreading via the community. Carolyn Listernick, what is the protocol if a student or staff member tests positive for COVID-19? Is the whole class quarantined? Who will cover the class if the teacher gets sick? No name. What is recommended when a student can't put their mask on themselves, tie their shoe, undo their pants to use the bathroom, or has an accident and needs help cleaning themselves? What is recommended when a student can't, again, no name. What social distance supports can there be for students who have difficulty separating from parents in the morning? Samantha Turcutt, what will professional development look like for teachers returning on the 31st, in person altogether or remote? Claire Latter, what happens if a child in my children's class tests positive? Will everyone in the class be quarantined, the teacher too, and for how long? Samantha Turcutt, what social distance supports can there be for students who may bolt? Eliza Kozo, what are protocols for restrooms, cleaning, masks, multiple students, etc.? Rob Giachetti, Nantucket is uniquely positioned in our region for a nearly full in-person reopening for the fall. From the school zone survey, 81% of the parents and 82% of the teachers share this view. Governor Baker has classified us as white and as ready to return to school full time. No name. Many teachers, myself included, come to work even when we're sick because it's easier than leaving students without adequate coverage, since subs, especially quality ones, are in such short supply. Anthony Supa, the school survey was not a comprehensive survey. It basically asked if you wanted a job or not in the fall. Samantha Turcutt, when a teacher takes a scheduled personal day, who will cover their class when we typically do not have subs? Kate Garrett, there are only 9 current cases. Per Governor Baker, there is no reason for school to not be back in school. We are in the white section, which per the government states we should be back full time. Anthony Supa, school survey to teachers. Suzette Brown, shouldn't the students be required to, quote, attend, unquote, school virtually on the days they are not physically in class 1 day a week in cohort B or C. Classes 1-4 on day 1 and classes 5-8 on day 2. Rob Giachetti. From schools that have reopened in Europe, my understanding is there has not been a single documented case of transmission from students to teachers. No name. How will cohort D students access instruction? Hold on a sec. What are the hours around this? Who instructs this? Gear. All students should be back in school in person with the teachers, given our community's metrics related to COVID. Governor Baker's recommendations indicated our students should be back to school in person. Shauna P. At what point does it become safe for children to return to school full time? What would the positive COVID percentage rate need to be? Claire Ladder. If we do not go full remote, how do we expect kindergarten to sit in front of the computer for hours? I'm sorry, I misstated that. If we do go full remote, how do we expect kindergarten to sit in front of computer for hours? No name. Are teachers expected to simultaneously teach remote students and face-to-face students? Same person. Will desks and tables be outfitted with plexiglass shields like many island businesses have installed? Angela Wagner. Which will limit the amount of students we can see in a day? Also, not all staff work full-time, which will impact service delivery with the cohort model. Deb Davis, to Rob G. This is false. 70% of the teachers do not feel that view. Later in the fall, if it is safe, yes. Claire Ladder. What happens if my child is sent home with COVID symptoms? Will they need a negative test to return to school?
Jen, I'm going to interrupt you for a minute. I think what I'd like to do now is I think during this conversation, some of the school committee members will have comments and questions that will probably answer some of these. So I'd like to hold off on public comment right now and go to the school committee. And then if you feel that there are other comments made that have not been brought up, afterwards we'll review them later. So I would like to start, first of all, by acknowledging, for myself personally, I wouldn't speak for the school committee, but this is probably going to be the single hardest thing I will ever have to make a decision on as a school committee member. When I took this position, I made a promise that I would always keep our students in the forefront of my mind, and I will always do what I believe is best for students and families, keeping them safe as well as keeping them educated. This is a very difficult situation, as we've clearly heard just now with the public comments. There are many different views and opinions, and I just want us to be mindful of this, respectable, please, and state your comments and questions. And I hope that we can have a healthy discussion this evening. So I'm going to start with Tim Lepre. If you would like to make your comments or questions, please, Tim.
Thank you very much. This is a vexing question, but in considering it, I found the remote learning really a problem. And I think our kids lost a lot of time and education because of it. So I sort of feel that that's not, to go full distance learning is not a viable alternative. I don't know that we're ready to have full in-school, a full in-school program, but I think the hybrid model gives us an opportunity to ease our way into that. Now, whether that happens sooner or later is going to depend on a number of factors, one of which would be the presence of community spread of the virus. Now, we don't have any evidence of that. And as Kate Garrett did the math for me, 0.97 is a pretty low incidence. So I think the hybrid model will allow us to ease into this, and we'll see if things go as I anticipate they will or hope they will. We could be looking at changing into a full school model, but I think I would like to see us start off with that, and that's my feelings on it. Thank you.
Thank you, Tim. Steve, I'd like to go to you next, and I know you had a question.
Well, I wanted you to have the opportunity to clarify something that appeared in the newspaper today and seemed to be coming from you. And that was to the effect that no matter what we vote tonight, the NTA has to approve it. And I did not know that was true. And I thought you might like to comment on it.
Thank you. That was not a quote from me. It was put in at the end of my quote from the paper, but I did not say that. I do not believe that to be true. Thank you for the question. Steve, I'd like to ask you to make your comments and questions, please.
Okay, well, I have quite a few questions and quite a few comments, if you're sure you want to start with me. And I think after I hear a few other things, I'm glad that Roberto's here, because I guess the first thing I'll comment on, and then I have questions about various aspects of the plan, is how we're looking at what I'm going to call the metrics. And I know we've heard from parents, I've been watching the select people in the Board of Health and Roberto, and I have a different perspective on a few aspects of that. First of all, the fact is that in Massachusetts, in July, the entire month of July, the average number of new cases per day was 200. For August, which we're only halfway through now, the average is about 300. So it's gone up 50%. That's one initial fact. I also have a problem with saying anything about 1%. I understand how the positivity rating works. But as an example, if we were, and I know we can't afford to do this, we've had this discussion, if we were to test the 2,200 students and staff that we have, that means we'd have 20 people coming into the buildings with COVID. If we tested and brought in, it's over half when we look at what's been proposed as a hybrid model. And I have no problem with the way it's been proposed. Our high needs students need to get in early, and then it would be approximately half of the remaining kids plus the staff, and we had all them tested, we'd be looking at 12 or more cases by that 1% positivity rating. 12 or more students and adults coming into our buildings. If they passed it to one or two others, one of my greatest fears is that they will then go home to a multi-generational family, and we know we have a lot of those, and pass it on, for example, to a grandparent who is not in a good position to fight this particular disease. So I think those percentages and metrics can be looked at in a number of different ways. And I think we have to consider that. And I want to respond specifically to something Rob said, and I read it in his letter. And I have heard about the schools who have gone back to school in Europe All of them, I've been told, went in gradually. They brought in a few classes at a time, or they brought in a percentage of their kids at a time. And in fact, there is one hugely terrible example. In Israel, they reopened all their schools. Within a couple of days, they had 2 or 3 students tested who had it. They took everybody out, tested everybody, and literally had hundreds of cases. So it's not true that all European schools have all gone back to school, certainly not full time. And I don't think that is an example that we ought to be using. And now here's the reason that I'm glad Roberto's here, because he's probably going to disagree with me, but at least when he's finished, I may understand it. We currently have diagnosed thus far in Nantucket, I think 46 is the number now, 33 of whom are over it, it's run its course, they're cured or no longer affected, or however you want to put it. So that leaves, what, a dozen or so who still actively have COVID. We also have the most recent wastewater report that says that there are 80 cases on the island. So that means if we subtract the dozen or so that we already have identified, that leaves at least 70 or so who actively have COVID on the island. And if they came from Massachusetts, they do not have to have quarantined. They could be in families who have more. I still don't understand these wastewater tests. I know Roberto has agreed that some of them have been flawed. I don't know why they get flawed, but the most recent one identifies 80 cases, and that means that we have 70 or 80 or more people on the island. And I guess I don't much care where they came from. Roberto has said a number of times they contracted the virus off island and brought it here. My concern is they're here. I don't really much care where they contracted it, but they're here, possibly passing it around. We have kids who have summer friends who come from other places that they've known summer after summer after summer, and I'm sure are interacting. And one of the parents who wrote to us acknowledged that when he looked around the island, there were just lots of people not wearing masks. Now, I assume he means outside of the 2 mandated districts. I just think that indicates that there are more people out there and a greater likelihood that we will have cases once school starts. Before I get to my questions for Beth, Roberto, do you want to respond to the way I'm looking at the numbers?
I can, yes. So what we're looking at here is, yes, if you're looking at the sewer numbers and you're thinking they're saying 80. So one of the issues with the sewer numbers is that with a relatively small number, we have a relatively small flow for our sewer plans. Is that when we start looking at that small issue, their margin of error grows, is the words I was looking for. So if you're looking at something like Boston, where you're looking at a couple 100,000 people in an area going, and even then the Deer Island sewer facility gets a greater of 1 million people, their margin of error is smaller based on their viral copies and the viral load that they're finding in the sewer. In our case, we're only seeing about 2 to 3 million gallons per day, which is not even, it's less than 10% of what the Boston facility sees. So our margin of error, it can be all the way up to around 30 to 40, maybe even 50%, depending on how low our viral load is. So they're overestimating the numbers, and they've even said that just because of how few we have. So in the laboratory, it's showing up as more. So basically what I'm trying to say is if you drop 3 drops of water or a virus into 1 cup will create a much higher viral load in that cup than if we were to do the same 3 drops of water in a 6-gallon jug. So that's what we're seeing with the margin of small, with the relic of small numbers. However, let's assume they're right on 80 people. 80 people are on the island at the time that we took that sample. And that's one of the things that's really important. Just like the PCR swabs, just like the nasal swab, that sample is only as good for the moment that the sample was taken. That number can change 3 hours after that sample was taken. So assuming 80 people on that weekend, on that day specifically, were on island and they were sick with COVID, or shedding COVID is really is the true answer. It's possible, and they were most likely asymptomatic, but they weren't spreading it. We would have seen a lot more symptomatic cases in those 7 to 10 days afterwards because of proper face mask wearing, proper hand washing techniques, proper distancing between people. So which is showing that these interventions are working. So in a nutshell, I know I rambled a little bit, in a nutshell, as long as the safety precautions are being adhered to, you keep that number low. So out of the 2,200 people that you're thinking, even if it is 22 people who are showing up to the school over the course of the week, if half the people are showing up, that's only 11 people at any given day showing up. They may not be showing symptoms, number one. And number two, as long as they're properly wearing their masks, they're following proper procedures, proper protocols, proper sanitation, they're not spreading it, which is what's really important here to prevent the spread.
Thank you, Roberta. I just want to remind
my mic to work. I'm not questioning.
Excuse me, just hold on one second, Steve. I just want to remind everybody to try to keep our comments and questions concise, because I know everybody's going to want to have their questions answered, but I just think it would be great if we can just make them more concise. Continue on, Steve. Thank you.
You haven't made me completely comfortable, Roberto. You've alleviated or relieved part of my concerns, but there's still people who are going to be coming into the school with it. And if there are people going out of the school with it, again, to those households with older people, that concerns me. I mean, I know we're just technically responsible for our kids, but if somebody's grandparent dies from this, we're all going to feel bad. I'll leave that alone for the moment. I do have a number of questions, and I spoke with Beth about these. I don't think any of them are going to surprise her, but I think it's important for everybody to hear the answers. My first area of concern with the plan is that we don't have enough custodians to adequately clean the way I've seen protocols talking about cleaning. And I didn't make an exact note of who said this, but some of these came from, believe it or not, the Massachusetts Association of School Superintendents is tweeting out information. And obviously DESE and the CDC are showing up as well. And they are suggesting that there are multiple touch stations, I'm going to call them, in the schools that need to be cleaned regularly. Door handles, light switches. I'm not making these up. I'm quoting from them. Door handles, light switches, water fountains, toilets, etc. And since I don't believe we're installing touchless faucets and such in our bathrooms, these are areas that these protocols and these people have said need to be cleaned multiple times a day, not just once at the end of the day, but multiple times during the day. And they've even used the words having people dedicated to that job. And I believe, and I would like reaction to, the need to have at least one additional custodian per building who's dedicated to those cleaning protocols. Have I changed your mind on that at all, Beth, or should I just go on?
I'm happy to respond in some ways, and I might ask Diane to weigh in a little bit. But I want to just remind you and others of what Roberto had said, which is we will be putting in place strict protocols with regard to wearing masks, using hand sanitizer, and washing hands with children and staff. So it is our hope that we will be mitigating some of this possible spread. We also know that different surfaces have different abilities to send virus out into the, there are different reasons. And again, I might call on Roberto to help me be clearer about this. But there's another piece, and that is we will not have as many students in the building. We will have fewer students and staff in the building. So that is an important piece that we need to keep in mind. Although, yes, we will, there will be a need for additional cleaning. We may see that it is more manageable because we have fewer students in the building. Diane, I know you and I have talked about custodial services. I know that your staff is very, very on top of things. They have schedules. They are making sure that things are cleaned. I would also, after I ask you to speak, I'd like to have Roberto explain a little bit more about transmission when it comes to bathrooms. I think you had a good point the other night. That will be important to address. But go ahead, Diane, if there's anything in particular that you want to share.
No, I just want to point out that, Steve, that's in our plan. If you read the custodial plan, all the touch points are identified. We were doing that before we closed down. When this thing just sort of started taking off, we were very, very conscious of handrails and doorknobs and anything you would touch, even elevator buttons. Those are in our plan. And to Beth's point, we are going to have about half the students in the building. Not saying that we're not going to follow through on any of this. We have every intention of doing so, but it is in our plan and we are capable of following through.
If through the chair it's okay, I might ask Roberta to share a little bit about transmission with regard to bathrooms and other touch points in particular. I know that we have addressed this and we've talked about it before. Are you okay with that, Roberta? You can speak to that a little bit.
Yes, absolutely. So one of the things that's really important to understand about the transmission is that when this was first starting to come out, there was a lot of fear about fomite transmission, which is the touch points that are being brought up. And in an article of July 3rd from the Lancet, actually, I have it open right now. I was just reading it as well. It specifically says that that sort of fomite transmission for COVID-19, specifically this strain for COVID-19, is not that high. The risk for transmission in a fomite transmission is very low. In order for that to actually happen, would need to have something of very high viral load on that specific contact point, AKA somebody would have to sneeze on a doorknob or cough on a doorknob, a very specific area. And then somebody would have to touch that exact same doorknob within an hour or two. So unless somebody is intentionally trying to soil something that's going to be a touch point, is really hard to actually transmit it that way. General passing through the hallway, somebody coughing, something like that is not necessarily going to do it because of the movement of the air in the hallways and through HVAC systems and things like that. The HVAC systems at the schools do meet the Federal Emergency Management Agency's standards for the movement of air and the exhaust of air. So one of the other things about with people who are touching is you're not going to be cross-contaminating yourself. If you scratch your face, lick your hand, anything like that, bite your nails, and you're touching your desk, as long as that desk gets sprayed down or wiped down in between before the next person, that should be enough to prevent fomite transmission. To answer to respond to one of the comments that Mr. Sorovich brought up was about not being completely comfortable. Nobody is going to be completely comfortable. This is a virus that we have never seen in the world before. It's brand new. We only saw it for the first time less than 12 months ago. Nobody's ever going to be completely comfortable with this virus ever again. What we're trying to do is get to a reasonable level of comfort, where we at least get everyone has met a level of relative comfortability with the plan to reopen. No one's ever going to be 100%. We can't start the schools open in a clean room. We also can't start the schools in a dump either. So it's a measure of finding a level of comfortability with the protocols here. And honestly, the protocols that I've seen Dr. Hallett and Diane O'Neill write and what is out there, I believe it is a good start. We need to see how things happen. We have to look at the way the behaviors are happening. Everything right now is theoretical in the papers. And through this protocol, the way it is written, I believe it is written very well and is very comprehensive.
Yeah, I just add a note of humor before I make a final comment about the health. When you use the word reasonable, that's how lawyers make all their money, is by arguing what is reasonable and what isn't. And I'm still not completely comfortable with it, but I'm willing to move on. I want to note, though, that because I now think it's part of the public record, our nurses sent us a letter indicating how uncomfortable they were with the concept of a hybrid opening and recommending, if I remember the wording correctly, a phased remote opening. And talk about our frontline workers in this upcoming experiment of ours. They are it, and they're not comfortable. They can speak for themselves at some point, but their letter now, I believe, since it's been sent to all the school committee members, is a matter of public record and will be posted on our website or is available if anybody asks for it. Beth, I'm not uncomfortable with what you told me earlier today, but I think for the public's sake, we should talk about buses and monitors and so forth. Where are we at on buses and bus routes?
So we are still chasing down some parents to find out whether or not they are hoping or planning to send their children back with buses. But I am pleased to say that many have opted not to send their children on buses. And I believe that we are in pretty good shape when it comes to being able to safely transport students to school using the buses that we have. We might not even need to have more routes added, so that would allow for us to be able to get children safely to the buildings when in one run. Where we might need to have additional an additional run would be if we are using the smaller buses for pre-K students. Pre-K needs to use a smaller bus for the safety features that are in place, and the same also for our special needs students who have needs that would require them to use a special kind of seating and bus. So that is where we are with regard to that. But I would say for the most part, as we are continuing to chase down parents, figure out where they are with transportation, what we have seen is that our numbers are good, and as we have to reduce based on the guidelines required by the state and the Department of Education, we are close to being completely able to transport our students with the runs and the buses that we currently have.
Without the chaos of multiple bus routes and kids arriving at different times and affecting starting classes. What about monitors?
Yeah, so let me finish for 1 second with,
Yep.
that. It may happen with preschool, but we are still seeing that right now that may not even be an issue. We're working on that. With regard to monitors, and I actually might ask Martin to jump in too, but monitors, we are considering hiring bus monitors so that each bus has an adult to help with making sure that protocols are in place that are required with wearing masks and seating and such. So that is an addition that we will be considering through the Cape Cod Collaborative. So Martin, I'm going to put you on the spot for a minute, and if you're welcome to just add a couple of things to that, because I know you have been directly speaking with Paul Hilton at Cape Cod Collaborative about our busing.
Good evening. Yes, we have had regular discussions with Paul Hilton, who is the business manager, the regional director for Cape Cod Collaborative. It's an ongoing issue with every district right now, trying to figure out how to transport the children. So at this particular point in time, we are looking at utilizing buses at around 32% capacity, which would fit basically a child per bench. And kids of the same household can sit together. So to your question, Steve, we are working on routes. I have a scheduled phone call with Paul almost every day. We're going to talk tomorrow. He was waiting to see what we decide tonight so we can go in more detail as to how to plan these routes and go from there. But if you have any further questions, I'm happy to address them.
Yeah, no, I just want to point out that if we have to hire monitors or do more than one bus route, and I'm not uncomfortable with the bus routing at this point, but if we have to hire monitors, and I've heard some mention of possibly using the monitors and the bus drivers during the day for various supervision responsibilities, with which I'm also comfortable, but that would be an additional cost as well. I mean, those people are not full-time, as it were, and that would make them full-time, and eventually those figures add up. So part of the reason, aside from the immediate health of the kids, which obviously is primary, I'm also concerned about the adding up of the expenses and how we're going to be able to deal with that, because you know how I respect you, but I think you're an optimist. With the chaos in Washington, I am far from comfortable with the belief that Washington is going to come through and provide additional funding for states, school districts, et cetera. And that's a to be determined later kind of thing. So thank you for your input. Okay, I got by chaos. Schedules. As near as I can tell, one of Mr. Horton's current 4 possibilities, and yes, Mike, I'm keeping up on your possibilities. I'm glad you're down from 11 to 4, and I'm sure you can make one of them work, but the other schools appear to be in a little different situation. My understanding is that at NEIS and NIS, NICE school's a little different, and I'm not completely clear on that yet, but at the 2 elementary schools, what's been suggested is that the teachers will have smaller classes and that those who are not in their classes will be remote, but they will not be being taught, as it were, by a certified teacher. And I understand the certification requirements have been eased up on a little bit. Beth filled me in on that. When those children are remote, they're not being taught. And if they're not being taught, I'm concerned. I haven't even heard a plan for supervising. One of the administrators, and I'm not going to name anybody, said the other day that they're looking at, I think they were called touch points, check-ins, that kind of stuff. That's not being taught. It was even mentioned checking in with those kids after 2:20, between 2:20 and 2:50. That's not being taught. So those students, as near as I can tell, in this hybrid model, would only be getting half their education. And that concerns me greatly. I'm not exactly sure what the story is at the high school, but it sounded to me, it looked to me when I saw what looked like a proposed plan, that they were even going to be possibly down to 1 day a week in front of a teacher. Now they're obviously more mature and able to do things on their own and be responsible, but 1 day a week in the hybrid model, I'm having a difficult time with, and I know Beth is going to want to respond to that, so I will mute.
Thank you. I just want to share some of the work that has been going on to help you understand a little bit more and help the public and the school committee understand a little bit more of what we have been working on with regard to instruction around hybrid. And we have two new great curriculum directors who have jumped in and really done a lot of research and a lot of work on this. And again, this is new research. This is not something that is practiced regularly across the world. So it is still new and developing, and everyone is looking carefully at it. So I would love to turn this over to Dr. Bardsley and Dr. Rabbold as well. So you can decide who goes first. It looks like Dr. Rabbold will go first. Thank you.
Mandy, do you want to start with that?
Sure. So we agree with what you're saying about learning being social. And whether we go hybrid or fully remote, we have to build in these social interactions from teacher to student and among students. In the spring, we tried to integrate many different tech tools into our instruction, myself included, being a teacher at that time. We also encouraged teachers to experiment and try new things and to be comfortable with that format. But we need to move from using tech tools to integrating them into our curriculum in purposeful and collaborative ways. And the model that we've really been looking at to do that is a blended learning model. Specifically, it's considered a high flex learning model.
So I can tell you a little bit about what that looks like in the research that we've been doing on that. And it is very new research. But what blended learning looks like is that there's always an online classroom presence. So there needs to be an online home base where students go to access information, participate in online activities, and share and post their ideas and their work. And there needs to be a seamless connection between online and offline work. So we need to provide learning activities in all participation modes, which lead to equivalent learning outcomes. So the learning outcomes will be the same whether kids are sitting in the classroom or whether they're sitting on their computer at home or doing offline work at home. Learning objectives are equivalent, but the modes and the times and the paths of accessing that may differ. We have to provide meaningful alternative participation modes and enable students to choose between participation modes. Not all teaching happens with direct instruction from the teacher to the student. A lot of the learning that students do is when they're doing, when they're practicing, when they're applying, when they're working with other students. We need to increase the student collaboration and engagement. That's something that we've been really doing research on what is going to help us do that. We've talked about building artifacts into everything so students can see each other's work because they learn from each other, from seeing each other's work. We need to use tech tools that can facilitate interaction and collaboration between students. We are experimenting with ways to reduce group size. We're adding more student choices through playlists and choice boards so that students are more engaged.
And your question also gets at how does this work with students at home and at school? And the way we're thinking about this is building an asynchronous spine that can be accessed at any time. So asynchronous meaning it can be done independently at home or in the classroom. But All the content and learning activities would be shared via links and apps within a learning management system.
So students in school might get lessons live, while remote students can watch recordings of mini lessons or something like that. The content knowledge that students are accessing can be accessed in multiple ways. It doesn't just have to be teacher to student, but what teachers need to really focus on is building and teaching skills like synthesizing and analyzing and problem solving, reading and writing, using academic discourse, modeling, engineering, asking questions, evaluating resources. That's the sort of thing that we want teachers to really focus on.
And I would add on to that.
Beth mentioned HighFlex to me today. It was the first time I had ever heard of it. And I did start researching it this afternoon. I can't help myself. And there are a couple of things that struck me about it right away. And I think you sort of referenced one of them, and that is that the classes would have to have video cameras so that the remote students could be watching what's actually being done in the classroom. And I obviously there's some significant cost involved in that. I also think there are privacy issues for the students whose parents don't want them to be seen or heard under those circumstances. And do I understand correctly, both from the little bit of reading, I admit I haven't done what you've done yet, that the individual teacher would be responsible for preparing the materials both for their in-person day and for the remote day?
So
doesn't that increase their workload substantially? And look, I'll back it up a little and just say there's got to be a real learning curve here for the staff. Yes?
So the first question that you asked was about the video cameras. And we're not advocating for video cameras in the classroom. What we're thinking about is how can we add collaborative moments in different ways? So it's the collaboration that's really important. And so I'm thinking discussion boards, record and respond to videos through Flipgrid or Seesaw, sharing Google Docs, co-writing and peer review, those types of things. But there could also be these synchronous moments, and I'll let Jen talk about that a little bit.
Yeah, teachers will not be responsible for students at home and students in the classroom at the same time all day. We may purposely schedule in synchronous moments when students at home collaborate with students in school. So at the elementary level, that may look like morning meetings or book groups. At the middle or high school level, it may be students at home logging in to participate in a debate in class that students in class and at home have done research for, or all students breaking out into small discussion groups, and all these small discussion groups in a classroom have members from home and school. And that's a scheduled time, pre-scheduled, but it's not all day long. Some of the HighFlex research that you may have looked at, Steve, deals with a lot of, it started on the college level because they've been doing this for a while.
Yeah, the word professor kept showing up in a lot of it.
Yeah. And a lot of the research with college students, professors were just recording their lectures. We don't feel, and the research does not back it up, that that is an engaging way of learning. So we would not suggest that.
So would it be fair to say, and this is going to sound like a lawyer's question, and I apologize for that in advance, would it be fair to say that you're just in the initial stage of examining these kinds of possibilities? And I mean, we would then have to go from deciding on a system to having professional development in that system, having the teachers get comfortable with doing it. I'm still not hearing that there's going to be somebody regularly supervising what those remote kids are doing, whether it's a teacher or a teaching assistant. And that troubles me.
Steve, I'm going to just interrupt for a minute.
Yep.
And just ask you to sort of keep this more concise, and rather than ask double questions, let Jennifer and Mandy answer. And then I also, just because looking at the time, I'd like to also give the other committee members an opportunity to ask questions. So if you could condense the rest of your points after you've received this.
Well, I'm hoping that we all realize, as you said at the very beginning, that this is the most difficult decision any of us have ever had to make as school committee members. I haven't been at it as long as you have, but I certainly agree with that. And I don't want anyone, I think probably the parents at home, because we're hearing from them, to misunderstand part of this. I fully agree that having our kids get to know their teachers personally and vice versa is important. That relationship. I taught for 35 years, you know, from second grade to middle school mostly. I absolutely agree that that's important. At the same time, so you know in advance, I'm not advocating that we go fully remote permanently. I do think there's some advantages to that, and I think that probably is a part of what we'll be wrapping up with. I'm not going to get into it now, but please believe I fully accept what everybody's saying about how important it is to get to the point that we have in-person relationships between our kids and their staff. There's no question about that importance.
That's great, Steve. Thank you, and making that comment. Dr. Raybould and Dr. Bardsley, do you have a response from Mr. Sordovik's question?
I think there's one important thing to talk about here, and that's the learning curve. And we made huge grounds in that in the spring. And I really do think that this is not going to be easy, but it is possible. And we have a lot of additional planning built in. So we're looking at the hit the mic. The half days. Wednesdays are remote. Are days that we can use for planning. We also have the additional full and half PD days throughout the year. We have the 10 PD days at the beginning of the year. And we're really asking teachers to continue the learning that they did in the spring and move that forward. So I just wanted to address the point that you had about planning.
And we're also identifying and developing teacher leaders who are experts or are, have a lot of knowledge in different technology integration and blended learning, who can teach and coach their peers. And we are building in a lot of collaboration time so that can happen. Mandy and I, certainly we're new, and that is our job. That is our whole job, to support the teachers, to model lessons for them. We are actually conducting our professional development in the beginning of the year, modeling what we want teachers to be doing in their classrooms. So we're actually trying to enact that for them. And we're really encouraging teachers to divide and conquer in teams. It is a lot of planning, there is no doubt, for single teachers to do. And for teachers to just be isolated in silos and do all the planning, that would be incredibly overwhelming. We're encouraging teachers who teach the same content to develop hybrid lessons or units together. Elementary teachers who are generally generalists, we're asking them to try to become a little bit more specialized in terms of their preparation. For instance, one teacher may take the lead on planning social studies and science for the entire grade, while another may focus on reading and writing. So really doing that divide and conquer and sharing the resources and becoming more collaborative as a team, which is the silver lining for this whole situation, honestly, is building more collaboration among teachers.
Madam Chair, I have one additional area, and I've received emails about this, and that's why I'd like to ask. It's my understanding that the current proposal at NES is that the kindergarten teachers have up to 18 kids in their class. And they, and therefore I, am very troubled about the concept of 18, what are they, 5 years old, kindergarten kids, 5, 6, somewhere in that neighborhood, having to sit at desks all day. You know, the lowest I taught was
Steve,
second
look-
grade, but no, please, Pauline, this is important stuff.
I was going to ask for
These
Dr. Hallett to
kids
respond.
are going to be bursting into tears, and you can't go near them because of the 6-foot distancing rules, etc. And I would ask the NES administration to try to come up with some kind of a plan that does not include having 18 kindergartners in a room at the same time.
Great, thank you. Dr. Hallett?
If I may, I would like to ask Mrs. Kubish to weigh in with this. And I do want to explain about the numbers. Our kindergarten spaces, we are able to accommodate the numbers based on removal of some furniture and based on the space available. So again, it is our belief that bringing students in and having that opportunity to build those relationships and to set in place those norms and learn how those things happen, learn how hand washing and mask wearing is important. And I also think after I asked Ms. Kubish to speak, I'd like to see if there was a chance that we could hear from our from Ms. Roberts, who is also has been involved with camp and understanding a little bit more about the younger students and where they're at. Without prolonging this, I feel that these two folks have some expertise in the area, and I'd like for them to answer if that's possible through the chair.
Certainly, thank you.
Thank you. Kim, feel free.
Unmuting. So thank you, Beth, for sharing the point about the space in a classroom. The kindergarten classrooms in NES are larger than any of the other classrooms in the building. Their capacity is for 18. That includes a teacher. And then Mrs. Albertson and I spent some time today going through the family responses to the different cohorts. And there will not be, Mr. Sordovic, 18 children in a kindergarten classroom. There will be, however, anywhere from 8 to 14 possibly. And that depends on the day of the week, and it depends on the groups of kids. One of the things that's so important to us, and one of the reasons that I would say NES did so beautifully between March and June, is because our teachers work together. And one of the things that we think is really important is for administration and teachers to work together. So we will be working with kindergarten teachers to create their plan, but they did an amazing job planning for the things that Mandy and Jen were speaking about before, the asynchronous and synchronous learning. Kindergarten teachers know exactly what kindergarten students need. Thankfully, our building has the largest field next to it. So we all know we want to take advantage of outside whenever we can. We want to, we know that kindergartners need movement breaks. If the room could hold 18 kids or 17 kids and a teacher, or 18 kids and a teacher, and we won't have that, there will be some space. And lots of what we need to do is help to teach. So in my Monday messages, I'm sharing that feedback with parents about things that they can be doing right now to ready their children to come back to school. And I think that Tracy can also speak to lots of the kids at camp this summer are the NES age level students. But most critically, our kindergartners are the ones that do not know the teachers at all. So first graders have seen the teachers from when they were in kindergarten. There may be some pre-K kids in our kindergarten, but that is the relationship we want to form and build and mold and help to prepare our kids to show them that they are safe and we are there to take care of them.
Thank you, Kim. And before Tracy comes on to make her comments, I think it's important for us to remember that the community school has been running camps, and the swimming pool has been open all summer, and Jetty's Beach has been open all summer. And so I think it would be helpful to hear from Tracy how that has gone for them, and what were there hiccups, were there stumbling blocks, or and then some of the protocols they put in place, I think would be helpful. So Tracy, are you prepared to speak? Thanks.
Sure. So I can quickly just go over what programs we've been running since everyone kind of returned and things started to open back up. So within adult ed, we run the testing center at 56 Center Street. And we've been testing through the months of June and July. About 64% of those tests were actually MTELs for teachers in the school district. And numbers around 135 visits to the building in June and 320 in the month of July for different employees working in the district. And what's been beautiful is that all these protocols have been put in place, screening of people coming into the building, whether they're employees or whether they're testers. And what we learned that there are great tools that you could just do online where people can screen, and it helps to educate them on what they're really looking for and becoming really aware of their own bodies before they're going into places. So Jetty's Tennis, we have been actually having really high attendance in tennis programming there. We are not able to run clinics. So people have been going to access play. There's rules about same households, and we've actually had more people at Jetty's this summer than we've had in any past summer. A lot of the private clubs are not allowing guests in their locations. And so we've been really busy, and there's a screening tool there as well, where people are expected to screen before entering the tennis courts. And the same at the pool. We opened the pool back up to adult lap swim and swim team, and people have been thriving there. They've been really happy. They feel safe. They're giving really positive feedback and feel confident when they're accessing those programs. We also manage the community rec programs out at the Delta Fields and Nobodere Fields. And so we've been doing education with those community partners to teach them what their programs should look like as we follow the protocols and share the education with people accessing those locations as well. So Nantucket Little League was accessing programming there. There's been soccer and lacrosse. So those locations have been really busy, and it's been really great. And then our driver's ed car is running every day. You probably see it around town from morning till night. We have 2 instructors that are working with students in the driver's ed car and following protocols there as well, with all of these screenings in place. And then as you spoke to Kim and Pauline, we're running camp. So our camp numbers are a lot smaller. We have roughly 30 campers every week. We've had great contact with parents. They do a pull-up drop-off. We screen campers before they get out of the vehicle. We screen the household. So we're having a conversation with parents about how their household is doing. And that's been beautiful because we've been able to educate families and educate kids on, the self-awareness of knowing how you feel. And we've had great response from parents who, if there's a day that their child is not feeling well, they're taking responsibility and they're saying, something's up. We're not really sure what it is. So we're going to take the day and we'll keep an eye on it. And then they communicate. It's actually been really nice. And then just in terms of takeaways, as I said before, the screenings have been huge. We've had to be really flexible. The guidelines for camps and some of these other sites have changed over the course of the summer, and we've had to adapt and change our policies and our protocols. But because we had a baseline to start from, it made it easy for us to do that, and sharing that education with the people who are accessing our programs was pretty easy. and people were very understanding of the changes. And so it worked really well. And I do have to acknowledge the teamwork part of this. We have a really small team, and they just said, okay, we'll do this together. They built the policies. They pulled from one to create another in each department. And we had support from the facilities department and from the tech department, from the DPW and from Remain, who is our landlord at 56 Center Street. And the teamwork part of it was huge. So the highlights for me are the relationships and the connections that were being built, and the support and the education for families and students, campers, and anyone who's accessing our programs.
Great, thank you, Tracy. And did you also were part of the administrative leadership team that worked on this opening plan, correct?
Yes.
Yeah, thank you. I wanted to ask Mrs. Albertson. I know she came on screen while Mrs. Kubich was speaking, and I didn't mean to cut you off if you had something that you wanted to add to the comment. No? Okay. All right, Kim. Thank you. All right. At this point, I'd like to move on to Zona Butler for comments and questions.
Can everybody hear me? Okay.
Yes.
I'm working with two different devices, so I apologize for that. So I want to start with a couple of things. Let's talk about the data a little bit, the data from the state and how we currently are categorized with the red, green light type thing. You know, your data is only as good as the data that goes in there. How much of that data, to me, represents our community, our most sacred community, teachers, students, admin, facilities? How many of those people have been tested and found negative and that sort of bit? So I'm not 100% confident with that, especially when we talk about the sewer results and their change and everything. There's just so many unknowns out there, and that concerns me. I've heard from parents, I've heard from teachers, I've heard from, you know, a lot of the stakeholders on the island, and I hear you. I, more than anyone that I can think of, understand that our students and our teachers need that social aspect of what comes with being a student and being a teacher and going to school every day. What I wouldn't give for a good old-fashioned hug from a person that I know other than my family. I understand the social aspect of it, and that some of our kids are just, you know, barely making it without that. That's important. It's important information. But what's more important to me is that they live another day for that to happen. And I'm just not sure it's safe yet. I want to acknowledge the team that worked very diligently on this opening plan. I think it is a wonderful start. I think there's some tweaking that still needs to be done, but kudos and thank you for addressing the state's requirement of us. And speaking of the state sets guidelines, but you know, we have to think a little outside the box. Being Nantucket, we're a school district that supports ourselves. We don't have other schools nearby that we can send students to when we have, you know, a situation where there's a need for that. We are out here and we have to be self-sufficient as best we can. And part of that is making the decision that's right for our most sacred community. I'm concerned about the teachers, and, you know, and having to develop at least two, if not three different plans for the start of school. I'm concerned about the stress involved with that. I'm concerned about, you know, the fact that in the spring, we were thrown into this remote learning situation without having a clue about where to start, how to do it. I think there are quite a few bumps along the way, but as I understand it from admin, from meetings that we've had all this week, is that they have a better handle on that. They know, they've identified the things that could have been done better. and they're able to address that a lot better than they did in the spring. So I would like to see a remote start with a gradual phase in of the hybrid. I also would like to see testing. In a perfect world, that's something that can happen. There are some funds, as I understand it, set aside some COVID-19 funds. And I'd like to see, as part of that gradual phase in, the people that are coming into the building be tested. Yes, that test is only good for that moment in time, but that's a starting point. You have to have a starting place. And if for that moment in time it's negative, at least you know where the contact tracing needs to start, type thing. And I just think it would give everyone a sense of comfortableness with everybody coming in to the building. That is, I'd like to see tested with that. I just want to make sure I address everything that I wanted to address. Yeah, I'm just concerned. Nantucket has been known to have little clusters, and it seems like clusters to us because we're so small. When we had, God rest their souls, the suicides back when my children were in school, that was a lot. It was overwhelming, and I'm sure in a city like Boston, it's nothing to have 3 or 4 suicides, in a year's time. That was a lot for us. Cancer, another thing that sometimes seems to happen in clusters. and it just seems exacerbated because we're so small. I just don't want to see an outbreak of the COVID-19 virus creeping into our lives because we just didn't take that one extra step to be extra diligent. I feel strongly about that. And that's all I have to say. Chair.
Thank you, Zona. I think at this point, Dr. Hallett, I was going to ask maybe if Roberto could answer some of those concerns, and then I'll come back to you, Dr. Hallett. Roberto, may I ask you to answer some of those concerns? Thank you.
Yes. So yes, just real quick on the testing. Yes, there is some money set aside that the town put up, which was $100,000 into $50,000 chunks in order to test people in the most high risk of situations. If I am to use the numbers that Mr. Sotovic gave earlier, which is 2,200, which includes staff, that's $330,000. We just don't have that. And also on top of that, we can't enforce what the person is doing in those 48 hours, 24 to 48 hours after they take the test to see if they're properly quarantined. All 2,200 people are properly quarantined. You would have to take all the tests all at one time. You'd have to quarantine them for 48 hours enforceably while the testing comes back. So it's the testing in a large scale like that is very difficult. So as far as the data that's going around from the state, yes, the data is only as good as what you plug in, garbage in, garbage out. That's typical statistical information. What we've been doing is working as hard as possible to get as robust of an information as we can get. We do have 47 cases that we've had since March, and that is an overestimate based on PCR. If we were to compare it to the state only has us written down as 37 cases, 10 less, because we are overestimating our cases based on the tests that we get done here at the hospital. The state doesn't count the tests from somebody who lives off the island, and we're here for only one day. The state doesn't count that as one of our cases, but we do, because we want to contact trace and we want to make sure that they were here when they were safe. And as far as there's also some real issues with the Fourth Amendment here. If we were to force people to get tested, That would be, and we require them to provide that information to us. That is considered an illegal search and an illegal seizure of a personal protected health information. So that's everyone would have to voluntarily agree to test because that is its own thing. We can't force it. And with the data, I understand. I'm a data guy myself. I get that there is an underrepresentation because you're only getting in general, the people who voluntarily come in to get swabbed for the test, in general, they're healthier because they want to know. There's a self-selection bias. So we are, just like with flu, we are underestimating their cases. That's just the nature of the beast here. And nobody wants to see COVID creep into our population, especially in the schools. I'm not advocating for the schools to open just because we feel that people need to be in school. It's not a party line. What we're looking to do is what I was looking to do when I read these protocols was to see if I felt reasonably comfortable in what these protocols were written. And I believe that's there. With the data, with our data and our metrics that we're looking at, I believe we can get a good enough cross-section snapshot that we can, for lack of a better word, that we can control where that outbreak is going if we do see the outbreak. And I'm sorry, I'm just trying to keep up. And it's one of those things that when we were talking about the interactions and the relationship that a student creates with the teacher and with the people around them, it is better to open as we can and create that relationship than to wait and not have that relationship start until the late fall. Interaction is incredibly important. We're hearing both sides. There are people who have students who are regressing socially and people who have their education regressing socially. And as a person who has done my degrees in both a traditional format, this one, and a non-traditional format, fully online, this one. My master's in business was online. My bachelor's and my master's in public health was in person. I also fully understand how little you learn from a remote learning situation and how disconnected from the people around you, socially isolated from the people around you are. And then my doctorate was also a hybrid model where I was in class for half the time and I was online for half the time. So that is very effective. So we're trying to see both sides, and the data that we have it from the state, from what we're seeing in Europe. Honestly, the balance is tipped to the hybrid model, in my opinion. And we have metrics that are very good. So if we wait to the fall to open, and if our metrics do blow up, let's say the state has, the state in Boston, there's a major outbreak and we end up with another spike, as we saw last Friday, the few can ruin it for the many. So Nantucket is doing very well, but because some people in Boston, Lynn, Everett, and Revere, we're having big outbreaks in the state of Massachusetts right now because they weren't paying attention to social distancing guidelines. The governor now had to issue orders for the entire state, and we suffered for that. I would say with our metrics so low, we can open that now, even in a hybrid model, in order to create that social relationship and that social interaction, so that in case the state issues an order to lock down again, we at least have had that personal and social interaction. Some interactions, some discussion, some in-person education is better than none. It's my opinion. I know that there is a lot of discussion on both sides, but I do believe that the hybrid model is probably the way to go now, before we end up in some state or national situation where we end up having to move fully online and we lose all the gains that we've had.
Thank you very much, Roberta. Dr. Hallett?
I just wanted to address something that Mrs. Butler had mentioned about 3 plans. I don't believe that we are asking teachers to create 3 plans. In fact, I might bring Dr. Raybould and Dr. Barsley back about how it's actually 1 plan, and that we are creating this or allowing for this to happen for some seamless movement between remote and in person. So if there's anything for you to share with us about that, I would be happy to turn it over to you. But I don't believe we're looking at 3 separate plans that we would be asking teachers to plan for.
We most specifically are not asking them to. We want them to be the same plan. We want students who are at home to be on the same page as students who are in the class, whether those students are just on their remote days, if they're in cohort B or C, or if they're in cohort D, they are welcome to join what's going on in the class. So I think that's really important in terms of, especially for some subjects that need a particular sequence, they need to be on the same page. I don't know, if, Mandy, you want to add to that?
I would just add that there are possibilities for teachers to tweak things when they have the kids in front of them. So instead of watching a video of a math lesson, the teachers will have that as a resource to help them in planning, and they have the opportunity to then facilitate the lesson with the students themselves. So it's really 1 plan with the learning objectives that are set, and then tweaking it based on what is available, the pros and cons of each learning model.
That really gives us the flexibility if we do have to pivot quickly. If if we did have to go to all remote as a district for some reason, we would be able to do that quite seamlessly. Or if there were students who, for whatever family reasons, could not log on to the class at the same time, they could still access that same content and stay up with their class. So that's very important.
And it also provides the opportunity if kids don't understand something the first time, because we have this bank of videos that we are creating, they'll be able to rewatch and stop and pause and kind of learn a second time around if they need to. And again, the teachers will be there with them in person.
Great, thank you, everyone. I'd like to call on Jen Iller now for her questions and comments, please.
Thank you, Pauline. I want all of the parents and community members who have reached out to us via email, phone. It's been a busy week for sure, but I appreciate all of the feedback. It's important that we hear from everyone. So I want to thank you, and I want to thank all of the people involved in the task forces who have developed this plan. I completely agree as a parent with school-age children that our students need to be in school, and I support the hybrid model for sure. However, being a member on the safety and security team for nearly 9 years now, I realize, and even listening through some of the comments that are being read, we still have many details that we need to work out to make sure that we're being proactive for our students and staff to be in school. So my key, thing is not rushing to get our kids and staff back into school until we have all of our protocols set, where there still needs to be discussion on, disinfecting in the middle school, high school, switching classes, who's responsible for disinfecting chairs and tables, fire drills, lockdown drills that were mentioned, how our school resource officers are going to be implemented, coming and going from school. I think about especially the middle school and high school, with our students wearing masks, it's hard we know we'll pass people that we've known them forever and we don't recognize them with our masks on. So how can we make sure that we're safe as students and people are entering our buildings with masks on? How do we recognize them? I feel very passionate about getting our kids back into school, but I still feel that we have work that needs to be done before I can comfortably say that I'm, feel good about all of our students and staff being in school And that's about all I have right now. Thank you.
Thank you, Jen. Dr. Hallett, would you like to comment?
Yes, and I might ask for some assistance from our principals. We understand that there is a lot of protocol planning, school and building pieces that still have to be determined. And I just want to remind people of the very short timeline that we've been given from the state. And this is not in any way any sort of an excuse. I'm just very simply explaining that we have had an immense amount of work that we've had to put in prior to now, with very little guidance that has come out in dribs and drabs in some cases, and often unfulfilling, so to speak. But I will tell you that the principals and assistant principals at the building level have been thinking very carefully about how these things are working. Why you haven't seen specific protocols, why you haven't seen some of these things addressed, is because we are still trying to collect information from parents. And if parents are listening and have not yet given us some of that information, we supplicate you to reach out to us and share with us what you are thinking for your child in the future here for this coming year. We do have plans in place. They are not yet published because we are working on them. We do have ideas, and we do have pieces that we would like to work with our teachers and with our staff to make sure that it is appropriate and it is what they feel will work. We understand that in some cases, we will need to have some pieces in place regarding entry and exit, or regarding people in the building, or fire drills. With fire drills, there is no question that we will be working with Chief Murphy to understand carefully how that will work, and we will need to have very clear pathways and protocols as to how to remove children safely from buildings. There's no question. All of these things, we have no question that we will be able to put into place, and that we will have those protocols. In those 10 days prior to the start of school, these protocols will not only be shared ahead of time, but also be exercised, so that we have some practice, so that we have an idea of how we can roll this out to students. It's important that we train our teachers and our staff prior to students coming in, and we will have to find ways also that we can still train students, particularly those who cannot come in or who are remote on certain days, so that they also receive the same information. There will be time that we will have to build in to our instructional day for some of this to happen, especially in our first few days. But please understand that we are thinking about this. This is not something that we are not addressing purposefully, or that we haven't thought about. So I might ask, for example, a couple of principals to talk just a little bit about where they are and what they're thinking with some of the things that Mrs. Iller mentioned, just to get some ideas out there. I don't know if any of you would like to volunteer to go first, or you want me to put you on the spot. Mandy, we'd love to hear from you. Thank you.
So thank you, Dr. Hallett and Chairperson Proch. It's my pleasure to let you know that one thing that we have done at the high school is we have outlined the protocols and the procedures that we will need to bring our students in safely. We have put that out to our department leaders and asked for their input, because we believe that it's everyone's responsibility to help design the protocols that we're going to need and the safety procedures that we need. That everyone needs to be a part of this, because it's going to take all of us working together to make sure that our students are safe, that our staff are safe. We have been holding office hours the last couple of weeks. We're trying to listen to the concerns of our teachers. Ms. Sarah Dellis and I both have been making personal phone calls with our staff. We've talked with parents, so that we are listening, and we are trying to get as much information from our staff and parents, so that we know what the concerns are, so that we are able to address those concerns. And we're asking our teachers to be a part of the process, because just the two of us, and just our leadership team, we cannot come up with every scenario and everything that we need to make sure that we are ensuring that we have all the safety procedures in place. Thank you.
Thank you. Is there any other principal who might want to share a little bit about how this planning is going? Thank you, Mr. Horton.
Thank you, Dr. Hallett. Michael Horton, middle school principal. As Steve alluded to earlier, I've gone through a variety of schedule drafts. Initially, I had situations with teachers staying more put, and I started with, students should be able to transition from room to room, and students should be able to eat in the cafeteria just at lower numbers. I have evolved from that to err on the side of caution that students will be in the same room, teachers will travel to the students, class sizes will be 13 to 15 to begin with. We are well within all the guidelines, and we are, tomorrow I have a school council meeting to work on an addendum to our CPS handbook that addresses, what does it look like for arrival? I talked with Kristen Holgate today about dismissal procedures. How many students in the bathroom at any given time, and how is that managed? Do students walk the same direction in the hallway? As Dr. Howe alluded to, we have all these things. They're just not public yet. Part of my frustration as a principal, we need to know where we're headed. And I am comfortable that we are well within all the recommendations and all the data and opinions that have been shared by Roberto Santamaria and Gary Shaw the other night, that students need to be back in school. And I've changed from some of the things that might be more convenient to the things that err on the side of caution.
Thank you. Anyone else? Eve Marie, thank you.
Hi, good evening. My colleagues have said it well with regard to knowing that our teachers have such great ideas and also come up with scenarios for us to problem solve. For that, I'm grateful. I agree with Mr. Horton about how we have had regular office hours with staff. We have had regular office hours with parents. We have had school council meetings all summer long, which is not typical. To gather those questions and to problem solve those things, in addition to everything that they have said. I have also talked with our building supervisor. I said, tell me about the things that you're talking about. And there are plans in the works with regard to marking stairways and marking hallways so students can visually see things like that. So we're working in collaboration. It takes a village, right? We're working with facilities, we're working with teachers and staff, we're working with parents. And I have no doubt, I think it's just a matter of putting it to paper. But as you all know, the priorities have to come with the deadlines. So the first priorities and deadlines are coming up with this really comprehensive plan. And then from there, we're gonna move into the nuances. But I have no doubt that we have over a month left before any student would step foot in our doors, and that we would have every single thing in place and discussed and problem solved and processed with our staff. Thank you.
Last but certainly not least, at NES, so I would say ditto, ditto, ditto to the comments that my colleagues have made. I would tell you, just to give people a perspective on thinking, at our school, and I know in the intermediate school, we have always done visits in the summer to allow parents to come in. We've begun already plotting how the visits would go individually with students and parents outside, making sure that students have the devices. We have talked about entry and exit doors that we will use. I think Diane O'Neill, it's really important that she's sort of left in this right now, but she has been working diligently with her custodial staff and our facility supervisors to plan for exactly what cleaning schedules will look like. it is back to, we need all of us to work on this together. And certainly the comprehensive plan is due tomorrow. And so as Eva Marie suggested, we have put a ton of time into creating that comprehensive plan. And I think it's important to make mention of again, that comprehensive plan was not created solely by the administrative team. That is a plan that we involve teachers and task forces in to help inform that plan. And so I too think that in a month, this will all be written down, shared, people will know what to expect, and we'll be working in the phased in plan from there.
Thank you. Steve, you have a comment? Thank you.
Well, actually, as uncharacteristic as it may seem to some of you, I would like to propose a compromise, and I can put it in motion form. I won't comment on it unless there's a second. The one note I would make is that if we're following Robert's Rules of Order, since it would be my motion if it gets a second and some people want to see some changes, I can make those changes. But I would like to make a motion at this time.
I would actually ask you if you could just hold on that motion. I haven't had a chance to speak myself.
You're right, you haven't.
I would like that opportunity, and I would also like to make sure that we've covered all of comments and questions. We have over 100 public comments, so I have asked Jen Erickson to group them together because I think a lot of the comments were repetitive. So, but at this point, I'm going to take the liberty in sharing part of, I can get my computer to do this, part of some correspondence that we all received from somebody that I greatly admire, and actually they put this far better than I could. So I'm actually going to read part of the email because it is how I feel and would have been part of my comments. Dr. Hallett has been the rock that has provided the solid foundation and formula to build a team chemistry for this group to work cohesively to a common goal. For a new superintendent to come in under these circumstances and perform in the professional manner that she has speaks volumes for her strength and abilities as a leader. This person and I wish to acknowledge the good work and level of dedication that this group continuously brings to our school system in the best interest for our children. No plan is going to be perfect. There will be problems that will need to be worked out and adjustments that will have to be made. The plan as put before you has been carefully constructed by the school's leadership team. The facilities department is diligently working to prepare the buildings to safely open in accordance with this plan. This plan will work if we can get all parties to put aside differences and work together in the best interests of our children. Over the past 8 weeks, our MPS leadership team has worked tirelessly through a detailed process involving and listening to the opinions, questions, suggestions, and concerns of representatives from every imaginable level of our school, our community, our state, to help us come up with the best possible opening plan for our school. The plan as presented tonight has been formulated in a professional manner, giving due consideration to the many opinions and viewpoints presented, and most importantly, with the best interests of our student population as our central focus. No plan is going to be perfect. There will be problems that will need to be worked out and adjustments that will have to be made. The plan as put before you has been carefully constructed by the school's leadership team. The facilities department is preparing the buildings to be opened safely in accordance with this plan. And this plan will work if we can get all parties to put aside differences and work together in the best interests of our children. Not only has this team, I'm now off of that person's comment, but not only has the leadership team worked hard on this, but over 100 people have worked on this comprehensive plan. Our nurses were part of the safety policy that is part of this program. plan. Our NTA union leaders were part of the committee's leadership plan and contributed and had planning to put this forth to you. I am, and Mr. Sordovic also had a chance to sit on the committee that was the community and parent committee. Dr. Hallett's email has been out there for 8 weeks at least for comments and questions and concerns. And I can't even imagine how many hundreds of emails that she has had to respond to. And I think that at this point we have really, aside from the surveys, I heard from the parent survey, I made a comment at our last meeting that perhaps we should do another survey on something, and everybody sort of jumped on me and said they're surveyed out. So I pulled that one back. But I'm hoping that the community is feeling heard. I am encouraged by the number of people who have joined us this evening. And I know that there are many conversations that are being echoed tonight, and I am going to give time to have Jen Erickson read some of those. But before we do, I just again want to note that the Nantucket Community School has been running and operating successfully and in a healthy way all summer. School starts September 16th. There is no holding that date back. Our children need to start being educated September 16th. However we decide that will be. We do not need to have a signed MOA with the NTA. We can move forward without that. It would be ideal if we could have that, but as I understand it, it is not necessary in order to move forward for the opening of school. We will tonight's purpose is that we need to vote on the draft plan, knowing that it is not set in stone and that it will be a draft plan with the idea of however we determine at the end of this to move forward for school to open. And I think that we can, and maybe this is where Mr. Sordovic was going to go, is that we can put in amendments or we can put in clauses that we wish to see. So when we do make a motion, I would just remind my school committee members that if we have a motion and a second, that allows us the discussion opportunity. And so that is the appropriate place for us as a committee to have that. At this point, I would like to ask Jen Erickson I've asked her to group some of the comments and conversations. So Jen, could I ask you to do that, please?
Certainly. I will, there is a lot of conversation going on in the chat. There's hundreds of messages at this point. 3 important messages that were specific from teachers and our union representation. I'll read those quickly first, and then I've kind of grouped subjects together. Alice Crawley says, the phased-in approach suggested by the NTA offers more direct instruction than the proposed hybrid model, where the remote portion of the hybrid model has not necessarily been addressed. Deb Davis says, teachers had a week to plan for remote learning. We now have the ability to improve on it greatly. Jean Witt suggested we need to think about equity. This will look different with different age and development levels. I'm concerned about a blanket approach pre-K to 12. Further, I've kind of come up with some categories of messages, many of them. I'd also like to state that there are many conversations going on within the chat and within people on the chat. Some of the specific ones were about cleaning materials, whether children will need to clean, cleaning for the therapists and the other specialist staff, various comments about gaiters, the wearing of gaiters, buses staggering start times, who's paying for the PPE, questions about testing. There were concerns, a few comments about concerns of heat in September and October, and about classrooms without windows. And there were quite a few questions, very specific questions about timing, number of days, what happens on Wednesdays, movement around the building, and whether children are actually learning every day. So that's what I could consolidate. As I said, there are hundreds of messages in the chat. And I apologize if I've missed anything really important.
Thank you very much, Jen. I don't know, I would invite Roberto or Dr. Hallett if there are any comments that you would like to address. Roberto, thank you.
Yes, one of the most important ones. Sorry about that. One of the most important things that was brought up, and you're absolutely right, is the neck gaiters part. We recommend at least 2-ply cotton or one of the other blue masks, which is what I was looking for before I dropped my coffee. That is what we're seeing with the studies, that the masks are really good at preventing a lot of the aerosolization. What we're seeing with the polyester fleece neck gaiters, the one-layered neck gaiter, is that they can break down the larger droplets into small aerosolized form. However, in the study, I did read the study, the person who did it, the physicist who did it, specifically said this was one trial with one type of gaiter. There are multiple different types of gaiters made from different types of materials out there. The density of the fabric does matter. And what he also did say in his conclusion was that that was only the one layer. Gaiters are large. They can be folded over, which is one setback from the study that they didn't do, that if there were 2 layers there, that it would probably be better, that it would help with the prevention. So right now, because of this information, we would recommend, at least for schools as they go, to work with masks at the minimum until more information about the gaiters comes out.
Thank you, Roberto. Dr. Hallett.
I would like to address the issue about PPE. I want to assure students, staff, parents that we will be providing PPE, but the recommendation from the Department of Education in the guidelines is that we ask teachers and students to use their own or bring and use their own cloth reusable mask. We will certainly provide disposable masks for anybody who does not have a mask, and we are considering increasing our PPE for our teachers with regard to offering a cloth mask as well for them. We want to make sure that everyone has the ability to be safe. We can look into face shields. We can look into disposable gowns. We want to make sure that our staff feel safe. We want to make sure that people are following protocols, and we have the PPE available for them. Obviously, this is going to be something that is an expense, and we do have funding that is available to us for these purposes, which is why we need to be very careful in how we plan to use our funding. And PPE, and Diane, you can certainly jump in. PPE is important, and we will do our absolute best to provide PPE for everyone who does not have their own. Of course, like I said, this needs to be budgeted for, and we need to make sure that we have the funding available for that. So I don't, if there's anything to add, Diane or Martin, please feel free, but if not, that's my response to the comment.
Thank you. I can speak to it as far as funding goes. There have been questions about the budget and where we are with opening the schools and budgetarily. Obviously, our budget is targeted to in-person normal learning environment. So, but to your comment earlier, Steve, I'm not necessarily optimistic. I'm just saying that as things look right now, funding we have in place, we think would be sufficient for us to open the schools and have enough funding to to go through sanitization of rooms and purchasing PPE as needed. Now, will things change throughout the year depending on what happens? We don't know. This is the environment we're living in. That's why I refrain from putting numbers on anything. I'm just operating with what we have right now and what I'm seeing that we have applied and gotten approved. And that is the 2 additional funding sources that we've talked about at school committee meetings before. One of them being the CARES Act grant that we got, and the other one being the Coronavirus Relief Fund funding that we applied last week and we're waiting confirmation on. Those 2 funds would be a great start. Whether they would be sufficient to cover all our needs throughout the year, we'll have to see. Again, I am very cautious about making any kind of forecasts at this point. The school year hasn't even started and we're still in preliminary stages. But at this stage, what I think we have in place is sufficient funding to open the school year and start with the plan that we have developed and see how the year goes from there.
Great, thank you. Thank you very much, Martin. I received from Jen Erickson that there were questions of people wanting to see the letter that was sent from the nurses. It is a public letter. It is available at the central office if you wish to go forward and request that. And the NTA union reps are not present on the Zoom meeting. And so I would not, I'm certainly not going to speak for the union. So that's not possible this evening. At this point, I would like to ask my school committee members if anybody has some comments before Steve makes the motion. Before you go ahead, Steve, let me ask anybody else if Jen or Tim or Zona have any other comments, questions? Okay. Steve, please.
As I said, uncharacteristically, I think a compromise would work. So I move that the Nantucket Public Schools adopt a fully remote reopening plan for September 16, 2020, with the provisos, note the plurals, that high-needs students begin in-person instruction as soon as possible thereafter and no later than Thursday, October 1, 2020, and that a hybrid model be reassessed for possible implementation no later than Thursday, November 5, 2020. End of motion. I want to point out just the reasons that I chose those days and dates. I would have preferred to say September 30, but that's a Wednesday, so it's a remote day anyway. Logan, I don't know if you're trying to write this down. If any of it passes, I will email it to you immediately with the modifications. And then I put Thursday, November 5 instead of, Monday, November 2nd, because Tuesday is election day. And I wouldn't think we would want kids in the school, hybrid or otherwise, on election day. We've had that conversation before. So with those 2 just explanations, I won't comment any further. I ask
need a second.
that it be seconded. Sorry?
Second. Is there a second? I'm not hearing a second.
Zona Butler, I'll second.
Okay, thank you. All right, so comments. I'm going to, I think the easiest thing to do is to have a raise of hands, please, if you have comments and discussions. Dr. Hallett?
I understand the motion that Mr. Sordovic had proposed based on the discussion we've had based on school committee comment. However, I would like to hear more of the discussion from the school committee. I do have some possible proposals that I could bring forward, but I'd like to hear first from the school committee. Just wanted to let you know that there are some alternatives that we have thought about in the event that the hybrid plan that we strongly believe is still the most appropriate plan need to be modified.
Thank you. Jen.
I'm concerned waiting that long to get our students back into school. I'm not sure why I don't feel it's our call to determine on dates. I think I would leave that to our administration. And, you know, I would like to say I agree and would like the hybrid model to happen. I just want to see all of the details that everybody was talking about that we haven't had, you know, in front of us. So I would like to adopt the hybrid plan after seeing those pieces in place. Thank you.
Thank you, Jen. Anyone else for comments on the motion that we have? Tim.
I appreciate what Steve is proposing. However, I am concerned that it's just delaying things. I think we need to move ahead with this. I certainly think the plan needs to be filled out, but we've laid the groundwork. We have to look at putting those other pieces in place. But I think delaying it doesn't make a lot of sense to me, Steve. I know I understand some of your thinking behind it and picking those dates, but I just think we ought to move ahead with the plan as outlined.
Thank you. Any other comments from the group before we go to a vote on the motion?
This is Zona Butler. I agree with Jen about the dates. I don't think setting dates is for us to decide. But I do like, you know, the remote start and a gradual phase in.
Thank you, Zona.
To the hybrid.
May I ask just if Beth could now talk about her alternative proposals?
Yes, Mr. Sordovic, but I'd like to make my comment first, if that's okay.
Please feel
Thank you. Thank you, sir. And thank you for raising your hand. I didn't note that. I think with the motion that's on the table, I am greatly concerned. I believe our children need to be back into school ASAP. They have been out of the school for 6 months. I know that many students did not fare well with the remote learning, and I realized that it was something that we had to put together quickly. And I think many people would agree that it was not as robust as we would have perhaps liked it to be, but we didn't have the timing or the planning to do that. I have great concerns for our high-risk students. And I also worry about Nantucket being able to continue moving forward and functioning. And no matter how many times we look over details, we're never going to come up with something that we know is 100% perfect, and we have to start somewhere. I believe with the plan that we were put in place and we were given to read, we know that there are a lot of protocols that haven't been developed yet because the task at hand was to put this together as detailed as possible for us to have a draft to discuss. I think Dr. Hallett and her team would be the first to say this is not the final plan at all. And I think it's been helpful to have the conversation and questions because it will help guide where the protocols need to be placed in and areas that we still need to research. We have a month still to do this. I think that the team has done an amazing job to have a 50+ page document. We have to remember that things changed. Things that was, at points were changing daily from the state. And so for this team to put together something as detailed as they have is admirable. And I would like to see us move forward on voting on the hybrid model, and understanding that we need to be flexible to move into remote for certain and obvious reasons perhaps. But I would at this point, before we vote on the motion that Mr. Sotovic has put forth, and we have a second, I'd like Dr. Hallett to provide us some information on the other scenarios that she would put forth. Thank you.
So again, as I've stated numerous times, what the leadership team and what the task forces have been working on very diligently is a plan that we can provide to guide you and to guide us to understand where we want to go with regard to instructional models for the beginning of the school year. We feel that hybrid is where we want to go. I want to clarify about the vote to this evening. If we plan to come into hybrid, then our plan is still a vote for hybrid because we can have an extended phased entry. So I just wanted to make that clear. The remote vote would mean that we would be in remote until further notice. So I would recommend that the motion either be amended, and again, this is not my decision to be making, but I'm just making a recommendation and an observation that that you consider voting hybrid and looking at a elongated phased entry as your motion. What I'd like to mention about how we have thought about what this might mean in considering having to potentially delay, although we strongly recommend against it, we would consider an extension by 1 week or by 2 weeks. So there is additional time and that there would be an opportunity for orientation. Let me explain a little bit if you bear with me for a moment. I just want to get to my notes on this. Thank you very much. For example, in the first, basically the idea would be that from September 16th to September 25th, this would be remote learning. This would allow for students to receive detailed instructions as to how and when to log in to homeroom advisory classrooms. Goals for the day would include back to school welcome, introductions, community building, exposure to the videos that would show protocols and the expectations for school. Now, we would normally do this if you vote for the plan as it is, and I still believe that that is the way to do it, this could happen prior to the 16th and also in the first few days. But now we are extending time. Cohort A would be invited to participate in individual meet and greets, orientation sessions, and other opportunities to meet their teachers during the first week, which means an orientation, not necessarily instruction. Instruction will be remote, but an opportunity to meet in person. Cohort A middle and high school students would be invited to participate in an orientation to learn the new safety procedures, and this can happen also in person at a smaller group level, so to speak. In addition, in week 2, which would be happening on Monday, September 28th, cohort A would attend in person. Cohort B and C would continue with remote learning. In the week beyond, Monday and Tuesday, October 5th and 6th, we would start to introduce our students in pre-K to 12 who are assigned to cohorts A and B for in-person learning. Cohort C and D will continue with remote learning until October 8th and 9th. This is how we see a potential phase in, and this is what we see. Although we don't consider it to be the best solution for children, it is something that we would consider based on the committee's recommendations.
May I just ask a clarification?
Sure.
To make sure I understand what Dr. Hallett is proposing. When you say cohort A, those are our high needs students. So they would be coming in first. The other cohorts, I'm trying to pull up a calendar here to be able to look at it. So those high needs, your orientations would be during the extension period. Yes?
Yes.
Cohort A would then come in starting on, oh, I'm still in August. Sorry, hang on. Would come in for essentially the week of the 21st.
Okay,
and the other cohorts B and C, because D is the people who want to stay remote, right? B and C would begin then on Monday, the 28th.
Okay, let me clarify. And I understand that you're not seeing this in document form, so I understand the challenge. In the first week between the 16th of September and the 25th of September, remote learning is for all students. Okay, so the first week and a half, basically, from the 16th through the 25th. The orientation meetings can happen during that time with individual meet and greets, orientation sessions with cohort A. And so they would have the opportunity to meet in person in small groups during this orientation period. Of course, remote learning is happening during this time. So this would be a part of their learning experience during remote learning from September 16th to September 25th. Phase 2 starts on September 28th. This is Monday. Cohort A will come in person and cohort B will come in person. Wednesday is actually a day of professional development. Excuse me. Yes, professional development. Oh no, my mistake. I'm just looking carefully.
The week of the 28th would be just cohort A, and the following week we would be bringing in B and C.
Thank you for clarifying. I was looking at the wrong part of my document. Thank you. So Wednesday would be a full remote day as usual, and then we would have cohort A and C coming in on October
1st.
Hang on, let me go back.
Well, that Thursday is October 1st. That's
the week of September 28th would just be cohort A.
Thank you.
The following week, that's okay. It's confusing. The following week, we would bring in B and C on their appropriate days. B would come in with A on Monday and Tuesday. Wednesday would be remote for all. And C would come in with A on Thursday and Friday. So that's
the week of the 31st. If I'm reading my calendar correctly.
There's no 31st in September.
I think you're in August again.
We're already in October. So
October
the
5th.
full hybrid model would go into effect on October 5.
That's correct.
Correct. Thank you, Jennifer.
No problem.
Okay. Now the question is, do you want me to rewrite this motion to incorporate that? I don't have a problem doing that. I told you, as uncharacteristic as it seems, I can compromise. So let's try to do this on the move. I move the remote reopening plan.
Could you
what was the
Steve,
starting date of that?
We would need to have an amendment because we have already had a second on the original.
Point of order. I don't believe so, Madam Chairman. Under Robert's Rules of Order, since it's my motion, I can amend it at any time. I believe that's correct. And what I'd like to try to do is amend it to illustrate, confirm, whatever the right word is, what Dr. Hallett has proposed. Because then we have a motion to adopt a fully remote reopening plan for, and that date was what? I can change it right now.
May I, through the chair, please forgive me, Mr. Sordovic, but may I recommend that you change fully remote to a hybrid phased entry?
Okay. Let me do that. A hybrid phased entry reopening.
Thank you.
No, I'm working on it. Now I have to type one finger at a time because of my computer issues. Say it again.
A hybrid phased entry opening.
Okay, hybrid phased entry. Now there's no hyphen between that, is there? Entry. Okay.
With full hybrid beginning for all students on October 5.
Okay, wait a minute. So we needed to change the date there, didn't we? A hybrid phased entry reopening plan for, isn't there some date in September that plan starts?
May I make a recommendation? Again, I know a lot of this is semantics, but my feeling is that if we have an understanding of when full hybrid will begin,
yep,
we can work out details that we have the ability to do. I am thinking specifically of the vote that needs to then go to the state.
Understood.
Tell me how to rewrite it is what I'm asking, I guess.
I had to have Jen that has a comment, please. Jen?
Yep.
Can I make a motion or make a motion to amend the motion?
You can, yes.
I'd like to make a motion to amend the motion to begin in hybrid model with the understanding that we will have all the details within the next 2 to 3 weeks for approval.
And by those details, you mean the various dates and so on that Beth was suggesting? Or are you talking about protocols and
all of the details, including dates, but all of the details, most specifically, all the protocols that they're working on.
I'd like to second that motion.
Thank you, Zona. And are you talking about starting school hybrid on the 16th of September, Jen, or is that the starting hybrid on October 5th?
Starting hybrid on the 16th.
No, I thought that's not how I understand. That's not how I understood it. I understood it that it's hybrid no matter what. It's a phase-in hybrid, right, Beth? That for a week and a half, everybody's remote.
Okay. I gave language for a possible amendment. However, it sounds to me like there is an amendment to that considers the 16th as our starting date and as and that to be approved after receiving protocols and specifics in 2 weeks.
That's correct. That's how I understood that.
Then I'm removing my second to that.
Okay, I will second it for the purpose of discussion. So at this point, we have Steve's motion with the amendment from Jen. So it is, if we enter into a positive vote on the current motion, it would be a hybrid program with the protocols, the questions and everything already answered before school goes back to session, so we would have it by September 16th, and we are voting on a hybrid starting September 16th.
Well, that's not an amendment to my motion. That's an entirely separate concept.
1 second, Steve. Jen?
I was also going to ask if the school committee could become somehow involved in the protocols somehow, so they're not arriving on our desk.
or our email.
So yes.
Yes.
Okay. So if the committee does not wish to vote on the amended motion, we can vote on the original motion, Steve's original motion.
Actually, we don't have an amended motion yet. We haven't voted on Jen's amendment.
Well, no, we haven't voted on it, but we have a second. So at the moment, that would be the.
That would have to be voted on first.
Yeah. So any other discussion? Are we ready to vote on the amended motion, which is going as a hybrid and beginning hybrid September 16th? If we have no more discussion, I am going to ask for a roll call vote. Tim Lepre?
Aye.
Steve Sotovic?
No.
Jen Iller?
Aye.
Zona Butler?
No.
And Pauline Proch, aye. So that's motion carries. And so we have the second motion out on the floor, which was Steve's original motion.
No, that motion has been amended. And that's what has to be changed.
But your amendment still has school starting back October 5th, correct?
No, it doesn't. Not anymore. Not after you people approved what Jen said. I would suggest that what it says now, after her amendment, is that Nantucket Public Schools, I'm keeping Beth's language, adopt a hybrid phased entry reopening plan for September 16. With the provisos, and now we have to say that all protocols and what else, Jen, have been completed.
I believe, Steve, that the motion has been voted on, so we can't vote on a second motion for a second. The vote carried.
With all due respect, what she did was change the original motion, and I'm trying to change the motion to reflect what her amendment to that motion said. I don't have a motion anymore. We have a motion that she has amended, and I just want to make sure that this says what she wanted. So the provisos are that all protocols and what else, Jen, are completed?
Yeah, all the protocols, all the details, and that we approve and feel that it is the safest plan possible before our staff and students attend school. So I feel like there is still the opportunity if we need more time to work on the phased hybrid plan.
Okay, so that all protocols and details regarding safety have been approved. Does that sound right?
Yes, yes.
I think that's what we voted on.
Yes.
So.
Hang on, I'm almost done. All so that I can read it back to you. All protocols and details regarding safety have been approved. Jen, right?
Yes. And again, I mentioned I don't want to rush into this. I understand everybody has been extremely busy with this plan that is due tomorrow. And I want to make sure we cover all bases, but it sounds like there has been a lot of conversation happening about what needs to happen in each building. And I think if we approve that and we feel comfortable with that, then I'm ready to move forward.
Okay. Motion now reads, and I'm not sure I'm going to vote in favor of it, but it now reads, I move that the Nantucket Public Schools adopt a hybrid phased entry reopening plan for September 16th, 2020, with the provisos that all protocols and details regarding safety have been approved. Period.
Okay, if the committee is more comfortable having a second motion voted, I would ask for a second on this with the changes.
This motion has already been seconded, Madam Chairman. So I'm going to pull a Robert's Rules of Order on you again.
Okay, I'm going to
and
say
move
then,
the vote, which means we have to go to the vote without further discussion.
and your vote, Steve?
No.
Jen?
Yes.
Tim?
Yes.
No.
And Pauline, yes. Thank you, everybody. I appreciate everybody's input. I appreciate everybody's time. Dr. Hallett, I will ask for you to reach out to the school committee to communicate with us on the opportunities that we can work with you and the team on the protocols. That would be terrific. And if there are any other comments before I ask for a motion to adjourn? Seeing none, may I have a motion to adjourn, please?
So moved.
Second.
Okay, all in favor? Steve?
Aye.
Thank you, Tim. Steve?
I guess.
Jen?
Aye.
Thank you. Zona?
Yes.
Thank you. And Pauline? Aye. Thank you, everybody.
And now, Logan, if I may, do you need me to send this to you as